Society Hong Kong. I'm Executive Director of Asia Society Hong Kong, Alice Mong, and it is really my great pleasure today, this afternoon, to welcome Professor Vernon Lee, who is a Senior Director of Communicable Disease Division at the Ministry of Health in Singapore, and he's also an adjunct professor at the Saw Siu Hock School of Public Health, National University of Singapore. And he sits on the Council of the Academy of Medicine in Singapore. And we're really delighted that we have this opportunity to discuss some of the issues, some of the lessons learned from Singapore on this episode 38 of our coronavirus update. Before we get started, just kind of setting some scenes. When we started the series February of 6 months ago, really never thought we would be episode 38. But the idea of this series was that Hong Kong, because we were in the beginning of the pandemic after China, that we felt we also have experts here in Hong Kong, whether it's at CUHK throughout Hong Kong U. And because of SARS experience, we thought many of our experts here in Hong Kong has something to share. And I think in the beginning, Hong Kong did really well, as well as Singapore, in terms of kind of the lessons learned from Hong Kong we were able to share with the rest of the world. And now, this last couple of months, unfortunately, with the rise of the fifth wave here in Hong Kong, we certainly have a lot to learn, and especially some of the stuff, the lessons from Singapore. So we're really delighted Professor Lee is here with us today, and to talk about some of the lessons here in Hong Kong. The last couple of days, I think we are under 500 now in terms of cases, and we also have about a dozen more, about 19 cases imported, and we're still under quarantine for those coming from outside. It's a 7-day quarantine, and one of the things I want to use this opportunity to talk about is just kind of what Singapore has gone through. So before I start with my questioning, we're going to ask Professor Vernon Lee to kind of give us some updates on 2 years COVID in Singapore. Professor Lee?
Thank you so much, Alice, and a very warm welcome to everyone. And I'm glad to be on this segment to share a little bit about our experience in Singapore over the past more than 2 years now. It has been quite a long road, a very challenging one, but we are seeing the light at the end of the tunnel. In fact, today marks the reopening of most of the segments of society in Singapore in terms of relaxation of many of our public health interventions, sort of the last interventions that we've decided to keep because it proves to be pretty effective against the transmission of COVID-19. And also as a reminder that the pandemic is still going on, is mask wearing indoors, especially in crowded places. And we also still maintain our vaccine differentiated interventions in sort of a large sized event and also at our night spots. But apart from that, people are back to the office. There's no need for any restriction in group sizes. People are traveling without the need for tests and so on. So I'll just run through some of our experiences over the past 2 years and some of our lessons learned. And hopefully that will be of help to your viewers. But I also wanted to say that each country's experience is extremely unique. I think if you look at all the countries in the world, everyone has gone through their own cycle of different interventions and different phases and timings of relaxations. So this is something I think we can learn from each other to see what best practices can we really bring together to enable us to deal with future waves of COVID-19 or a future, what WHO calls a disease X, an unknown disease that might happen in the future. And it's likely to be a when, but not, if, but not when that would happen. Okay, I'm just going to share my screen. Can everyone see my screen?
Yes. Okay,
thank you. So I'll just give a little overview about Singapore's COVID-19 situation at this current point, our responses over time, some of the things that we had done in the past, but like I mentioned, have currently been stood down because we are in a phase of the pandemic where we are very much focusing on high vaccination coverage, low severity and complication rates, and for the actual sort of COVID case counts, we're less focused on that as a community at the moment. and then also our overall approach using all these various modalities, and finally, our current reopening and also planning for the next variant or disease X. So this is the epidemic curve of the COVID-19 outbreak in Singapore, the entire epidemic curve sort of laid out in one long string. You can see we had our first imported case from China that was in January of 2020. And then we had an initial increase in cases around about April of the same year. And we went into a circuit breaker, sort of a limited lockdown for almost 2 months. And things like mask wearing were made mandatory. And you can see that was actually quite effective at bringing cases down to a very much lower level. And therefore, we opened in small phases in June of 2020. And we kept cases actually very low. At that time, a lot of these were necessary because we were faced with a disease that was somewhat severe, certainly more severe than a lot of endemic respiratory diseases. And also there were no pharmaceutical interventions, no vaccines or therapeutics that were available then. Well, that quickly changed by the end of 2020 where vaccines were available. So we further reopened and started our national vaccination program, which I'll talk about later. Of course, subsequently came the more transmissible Delta variant and subsequently the Omicron variant, resulting in further spread. You can see quite a lot of cases from the Delta variant that affected us in October to December of last year, and then the Omicron variant over the first 3 months of this year. That resulted in the establishment of some of the safe management measures, our term for the public health interventions that we had to put in to sort of reduce the impact of these waves, not to suppress the waves totally, because we realized that we have a very transmissible virus. It's not possible to do so, but we didn't want a runaway wave as well that would result in, for example, overwhelming of the healthcare system or a lot of severe cases and deaths. So what we wanted to do was to flatten the curve, so to speak, to result in less cases, less severe cases, so that at any one point in time, so that our hospital healthcare system can actually cope with it. We did pretty well on that, and also very well on our vaccination and booster coverage. And right now, based on our current situation where our healthcare system is coping very well, it's pretty much back to business as usual. Few COVID cases in hospitals at the moment. We have a very high vaccination coverage, and we are able to open up most of our society and also borders to the rest of the world. So our national approach to dealing with COVID-19 has been one that is predicated on a national crisis preparedness and management framework. It's a whole of government framework that all ministries, all partners, and all stakeholders work together. It's not just the health sector alone, because COVID-19 transcends way beyond the health sector. The 3 pillars: we prevent infection as much as possible. And now we have a vaccine. We have different measures that we can use to effect that to a certain extent. Should the disease establish itself or spread, we of course want to be able to detect it. And finally, to be able to respond to it based on many of the plans and operational programs, activities that we have to try to minimize the impact as much as possible. As I mentioned earlier, whole of government planning and coordination is extremely important. Also capacity building, not something that we do only during the pandemic, but this is something that you have to plan ahead of time to build surge capacity, to build the foundation of all the different programs that we can bring to bear during the pandemic itself, and also a good national legislation, policy, and financing programs to help us, to bring us through this very difficult pandemic. So as I mentioned, the multiple modalities that we've had, prevention through our public health interventions, our border controls, especially initially where we didn't have a vaccine. Detection, so this is our test, trace, isolate program. So case finding and surveillance, ramping up our testing capability from about 2,000 tests initially to about 80,000 tests per day at the peak. Care, building up healthcare resources, not just in hospitals, but also in the community, so that we can right-side patient care and not overwhelm hospitals with patients that actually do not need hospital care. So we can reserve tertiary hospital care for those patients who most need them. vaccine and treatment, both research and acquisition of those pharmaceuticals. And finally, to contain spread where necessary. So this is the contact tracing that we've done, and also building up a quarantine capability, especially in the initial phase where we needed to place individuals under quarantine to reduce spread of the disease. So some of the things that we had done, border measures, of course, initially in early 2020, we started with doing health screening, and then of course travel restrictions, very much the same as what the rest of the world have done. And this is extremely painful for a globally connected economy like Singapore, where people travel in and out of the country quite frequently. But this was something that we had to do to slow down the importation of cases. You can see that the number of imported cases actually accelerated somewhere around March of 2020, and that coincided with the surge in initial cases globally. And so Singapore, unfortunately, because we are a globally connected city, a lot of these things, will impact us substantially. So we put things like, quarantine, or what we call stay-at-home notices for visitors coming from various countries, and also travel restrictions from countries with very high COVID-19 caseloads. But of course, we realized that we couldn't do this forever. I mean, Singapore needs to be connected to the rest of the world. So we started to move away from a containment posture to one to mitigate the spread of the virus and to be able to detect cases early, especially those with new variants. So we had a process for pre-departure testing.
Recording in progress.
To reduce the importation of cases. So you have to test negative before coming to Singapore. And also in Singapore, we put in place processes for testing on arrival, and also quarantine as needed, depending on the situation. But of course, along the way, as Singapore became more highly vaccinated, where other countries had their vaccination programs in place, we moved towards vaccinated travel lanes, where we set up these travel lanes with countries with good vaccination programs, and we allow vaccinated travelers to come in without quarantine. And now, of course, we're in a much better sort of state in the pandemic. We have lifted all of these travel restrictions. So for vaccinated travelers, they can come in without any test or any quarantine. For unvaccinated travelers, to encourage vaccinations and to protect them from possible exposures, we do put them under quarantine at the moment. Surveillance has been transformed across the past 2 years as well. We've put in place a lot of different surveillance programs, from initial case detection of individual cases to community testing. At one point in time, we were testing all acute respiratory infections for COVID-19 using initially PCR and then the antigen rapid tests. We've also been ramping up our genomic surveillance to be able to detect the different strains and variants of COVID-19, so that we can piece together what strains are circulating in Singapore, but also what strains we were importing from our borders, so that we can be on alert. And then we also use wastewater surveillance, which has been used in many places in the world. This supplements our other surveillance systems as a sort of a validation tool. Next, test, trace, isolate, or quarantine. So we have also used technology to help us to do this faster and more efficient. So our Bluetooth-based community tracing app called Trace Together. So we have rolled this out quite broadly. The app also serves, and you can see in the center, to indicate a person's vaccination status, because for the longest time we had a vaccine differentiated public health interventions and entry to various locations. So you need to be vaccinated before you can, say, go to a shopping mall or dine at a food and beverage outlet. So we use the app for that, and also a check-in to various locations. So if you go into a crowded location, a mall, an office, a F&B outlet, you have to check into that location, so that when there's a case, we can determine where the risk might have occurred, or when there's a cluster of cases, we can actually go in and investigate. And then for those who are contacts of cases, we send a notification to that individual to do the necessary as a close contact. Of course, for the close contacts, initially we place them under quarantine in dedicated facilities. Then we move towards a more home quarantine process. And then later on, as we are able to manage cases and the quarantine and containment processes move towards a mitigation posture, we set up the health protocols where we say that if you are unwell, please see a doctor. If you test positive but you're well, you can self-isolate at home and you can do your own test. And when you test negative, you can de-isolate and you're free to go. And if you're identified as a close contact, you just take a rapid test every day. And if you're negative, you can go out. And if you're positive, then you go to the protocol 2 where you self-isolate. So we make things a lot easier, and we don't want to crowd our quarantine facilities or hospitals with pretty much well individuals. Of course, now, like I mentioned again, we've done away pretty much with the contact tracing, but we've kept the health protocols in place. So if anyone still tests positive, we still ask them to self-isolate and to inform their close contacts, not by the government, but by themselves as a form of self-responsibility, so that they can then do their tests as a responsible citizen. So for example, myself, I was a close contact, also informed to me as a close contact of someone last week. So I took my test daily before I go out every day. Then some of the public health interventions that we've done, as I mentioned, the vaccination differentiation for entry into certain locations, and a lot of different things we have done. For example, group sizes, keeping safe distance from each other, and using this check-in. So a lot of IT-enabled technologies. Of course, right now we have stood down most of these, but we are still keeping them warm at the back of our minds, just in case there's a new variant or something that requires us to activate these things again. Then next is vaccination, which is one of the foundations and tenets for all of these relaxations that we are able to do now. So we have set up a whole bunch of vaccination centers, several dozen across the island, to make it very easy for people to get access for vaccination, which is given free to anyone living in Singapore. We also have outreach to different individuals by the People's Association, which is our grassroots organization, because there are many individuals who are not certain about whether they should take the vaccine, what vaccines they should take, and so on. So we want to actually reach out to them by grassroots organizations rather than just by healthcare professionals, because grassroots individuals would know exactly what their residents require. And then in addition to that, because there's no single solution that will enable a high vaccination coverage by itself, for those who are unable to access the vaccination centers or who might be concerned about the vaccines, we set out mobile and even home vaccination teams to go door to door to deliver the vaccines to different individuals. So through that, we actually managed to vaccinate a very high proportion of our population. You can see as of earlier this month, about 96% or more than 96% of the eligible population has received their full vaccination regimen. That translates to about 92% of the total population, less those below 5. And about now almost 3/4 of the population have received their booster shots based on the time norms after the initial vaccination regimen to receive their boosters. The other thing is also building hospital capacity, because we realize that if we put everyone in hospital, the hospital system will be overwhelmed very quickly. And what we do not want is for the very ill to not be able to receive care because hospitals are overwhelmed. So we set up different programs to enable right siting of care. For example, the home recovery program for people who are mild asymptomatic to recover at home, but with access to medical support through telemedicine. Then also facility-based recovery in the community. So isolation facilities, treatment facilities, where patients who do not require hospital care can be moved towards. And these are facilities that we've built to a very high standard. For example, treatment facilities will have medical support and even oxygen supplementation so that they can be right-sited in those locations, freeing up the acute hospitals and the ICUs to deal with the very severe patients. So at the peak, at the height of the Delta and Omicron wave, while the healthcare system was certainly stretched because, there were a lot of cases, it was not overwhelmed, and everyone who needed care was given care at the appropriate sort of a facility. So what's next for us for COVID-19 and beyond? Certainly vaccines, antiviral drugs have helped us to deal with these waves quite nicely. And this is something that we are continuing to invest in and looking out for additional new vaccines or new therapeutics, reopening of society and economy, which we felt we had to do, and that we are in a good place now where we're able to do this confidently without concern about overwhelming a healthcare system or having detrimental effects on the health of our population. Reopening our borders, which we are essentially fully reopened as of today. Of course, participating in international research, which is extremely important. And international research has been what has brought us a very effective vaccine very early on. And of course, preparedness for disease acts. Never rest on our laurels because we don't know what's going to happen tomorrow. So as some things are being stood down, a lot of the preparedness machinery is still going on because we are trying to do better. Even if, for example, the next variant of COVID-19 comes about, we want to be able to respond in an appropriate and in a proportional manner. So much of our reopening and transition has been initially a pandemic response and then transitioning to what we call a resilient nation, one that is able to deal with the impact that the pandemic brings, but to carry on with life as much as normal as possible. So for example, testing. In the initial phase, we were very much focused on accuracy with PCR test. Then as the cases started to grow locally, and as other tests became available, like the rapid test, we wanted then to move towards increased coverage for people to know their status, not so much for 100% accuracy. And then now it's very much local and international surveillance. We've moved away from trying to test every single case because it's not currently of a great need. But we want to have that local and international surveillance to be able to detect future variants or future diseases. As I mentioned earlier, treatment and recovery, essentially very much hospital-centric initially, isolation in hospital, to one that's community-centric and now home-centric, where people can deal with COVID-19 much as previously, before COVID-19, they deal with the flu or any other endemic diseases. Contact tracing, initially very extensive rings to try to identify every single contact and put them under quarantine, to more targeted contact tracing, and right now, limited or no contact tracing, very much self-responsibility for people to inform their own contacts if they're exposed. Quarantine, as I mentioned, isolation from the community to isolation in the community at home, and right now, self-testing, where people who are contacts can actually get on with life as per usual, but we encourage them to test before they interact with others. And the community measures, initially very much that hammer and dance approach, which was, I think, expounded by Thomas Puyol very early on during the pandemic, where you sort of take a hammer, and that was a lot of what we did in terms of that lockdowns to try to reduce cases to a very low level. And then you dance with the disease with openings, but when you see the disease going up, you sort of do a bit more restrictions to bring it down and so on, but realize that that's not possible with the very transmissible Delta and subsequently Omicron variants, to one of calibrated easing. So we managed to ease quite a fair bit, but we wanted not to ease too much that cases would rise very quickly, severe cases accelerate, and our hospitals and healthcare systems overwhelmed. So it's very calibrated. But right now, when our hospital systems are not under threat, we are obviously opening up, relying a lot on self-responsibility. And we're hoping that a lot of these good practices that we have inculcated into the population will stay. Things like mask wearing when you're in crowded places, or not going out, putting on a mask and going to see a doctor when you're unwell, and having good social responsibility and hygiene. I think these are good practices that we want to really inculcate and hopefully can stay in the population for the longer run, because not just for COVID-19, for seasonal respiratory diseases and for anything that the future might throw us as well. So I think that's my last slide, and thank you so much, and I'll be happy to take any questions from Alice and for the rest of the audience. Thank you.
Thank you, Professor Lee. That was very comprehensive. And I want to start off by asking really the vaccination question. In terms of this, what Singapore has done so well really is tackling the vaccination. I think even that tail end of 2021, it was already kind of one of the most vaccinated country in the world. And I think Hong Kong and Singapore and many other countries had the vaccine about the same time. But how did the government get that done so well. My primary concern really was about the elderly and the children. How did they coordinate to get that? Here in Hong Kong, we're still kind of addressing that a little bit. So, and of course, the fifth wave, we saw the outcome of that because how much the elderly were impacted by it. But how did the government kind of, what approach did it use to get that successful vaccination rate so high so early?
Thank you. That's a very, I think, important question indeed. And there's no single solution. It is actually, like what I mentioned earlier, a multi-pronged, multi-solution approach. There's no single optimal solution because every solution has diminishing returns after a while. And therefore, you need these multiple modalities to try to reach that very high vaccination coverage. And even then, it's not going to be possible to reach 100%. But we try to get there as much as possible. I think the first thing that we had is trust in the government and national policies. And this is not something that you build up just during a crisis. It takes years to build a lot of trust, a lot of engagement, like I've mentioned, a lot of communications that the government has put out during the pre-COVID period, talking about different diseases, seasonal vaccinations. We launched our for example, national adult immunization schedule about 5 years ago. We had, of course, adult vaccination schedules that we have been putting together across time, but we tried to bring them all together under one roof, and also provided subsidies for individuals to get vaccinated. So this enhanced our childhood vaccination program by bringing the adults, especially the elderly, into the fray as well. Of course, good communications to counter misinformation. There's a lot of misinformation now with the advent of social media. And unfortunately, it's easier to put out misinformation than it is to put out real information and data, because the truth needs time to process. You need to process the data. You need to put it out, to the public. So we need to have a very good communications team to be able to put this information out there through various modalities, including through use of social media. The other thing is good operations. So as I mentioned earlier, the vaccination centers. A prioritization program where initially when vaccine supplies were still limited, we wanted to get the elderly, those who are vulnerable, to come forward first, because supplies were limited, the capacity to vaccinate individuals were limited as well. Thereafter, as our vaccination centers opened, we then invited the rest of the population to come forward, and they got vaccinated very quickly. So the operations cannot be underestimated. It is a huge operational task. Then, of course, we use nudges, like I mentioned earlier, the vaccine differentiation. So the nudge, once we got to a very high level, but sort of hovering around there, we said, okay, let's nudge people to get vaccinated. So if you're not vaccinated, to protect the individuals, because if they get infected, we know that individuals who are vaccinated have 10 or more times lower risk of getting severe infection compared to unvaccinated individuals. So we said, okay, if you're not vaccinated, you cannot enter crowded places or food and beverage outlets where people take off their mask and so on and so forth. So people, or even travel, and it's not just Singapore, but a lot of countries require vaccinations to travel. So people start moving towards getting vaccinated as well. And finally, as I mentioned, the mobile and home vaccination teams with grassroots community volunteers and medical staff to really go door to door to get the last group of people vaccinated. And through the mobile and home vaccination teams, we managed to vaccinate many tens of thousands of individuals. So all this sort of added one on top of the other to achieve a very high level of coverage.
I think you have a really interesting point there about communication, really from top down. One of our questions or comment from Mark was, Singapore government led by the PM senior minister has been very proactive in communicating with and engaging with the public as part of his crisis management program. How effective has this communication and engagement been in securing the public support in managing a pandemic?
I think communications is crucial. It's one of the critical pieces, because people will believe what they see to a certain extent, and they need to be engaged with. I think what people want is a government and a leadership that is transparent, that tells people what they know, also tell people what they do not know. And a lot of times, a lot of the measures are a bit of a co-creation process, where the government will say, this is the best solutions that we have for the moment, but things will change, of course. And we also look at what the public preferences are through various surveys. So that's very important as well, to know what the people actually want. And interestingly, I mean, a lot of people want different things, so you can't please everyone. But it's important to communicate the rationale of why we do certain things. Whatever we do is not going to be 100% popular. There are going to be people who are for it. There are going to be people who are against it. But more importantly is, how do we communicate the rationale so that the whole country can come together and do what is most important and get us through the difficult times. And there have been difficult periods during the past 2 years. I'm not going to deny that, but I must say that as a whole, the communications program has been very effective and has brought Singaporeans together and stronger after these 2 years.
I have to admit, doing a couple of the some of the low points here, getting the videos that the Prime Minister has sent out from friends across, even though I'm living here in Hong Kong, the video was shared in the US all over. I have to say the communication was quite comforting, even for some of us here who did not live in Singapore. So I think you're right about the effective communication from top down. And even today, I think in today's paper, one of the ministers here in Hong Kong admit gaps in works here in some of the fights here locally about the pandemic. So I think you're very much right about the kind of the holistic approach that the government has kind of brought upon. Another question, and I think also from the audience, was about another thing that Singapore has done so well is really the low mortality, the fatality rates. Again, one of the lowest, and I look at Hong Kong's numbers, even pre the fifth wave, our numbers were low, but again, because of the elderlies, with the deaths in the elderly, and many of them in the nursing homes, during this fifth wave really brought Hong Kong to a terrible place. But in terms of the fatality rates, of the low fatality rate, even though it's still, my understanding is the every day, I think it is still, the COVID rate is still quite high compared to Hong Kong. We're under 400. But in terms of the fatality, I mean, Hong Kong, for a while there, the rolling 7-day average fatality rate was quite high, one of the highest in the world at the time. So how do you address that? I'm sure this vaccination has something to do with that.
Indeed, vaccination is one of the things that have to do with it, but it's not the only reason. I think if you look at the number of cases and fatality rate or the severity rate, what we really want to focus on is actually the severity or the severe outcomes, not so much cases. Because I mean, if you look at cases alone, a lot of people like to look at how many cases are spreading in a certain population. But I think if you look at many endemic diseases, take seasonal influenza for example, and many other respiratory diseases, I mean, you have many cases every year, and we don't bat an eyelid about it because many of these cases are not severe. And that's fine. What we've been trying to do is, in fact, keeping the spread of the disease under check and to, like I mentioned earlier, flatten that curve. We're not so much concerned about case numbers. What we do not want to have is uncontrolled surge in cases, because even if a very small proportion of those cases are severe, when you have a very large number, that small proportion becomes a very large number as well when it's multiplied. So we didn't let our cases go out of control. We kept it under check by various means, including public health interventions, which the public has been very tolerant of and been very compliant in adhering to them. The vaccinations, like I mentioned, very high vaccination coverage and booster rates. And the vaccines, have been proven to be effective in reducing severe outcomes. Maybe less effective in reducing infection, and that's why you still have infection even among vaccinated or boosted individuals. But in reducing severe outcome, it's been very effective, especially based on the cellular immunity, which is quite long-lived. Sorry.
Go ahead.
Yeah, the third is pharmaceuticals. So we've also invested in purchasing and stockpiling of various pharmaceuticals, whatever is available, and new pharmaceuticals that come on the market. We make them available, especially to the more severe cases or high-risk cases, so that they do not turn severe, and we keep the mortality low through that as well. And finally, the good clinical management protocols, as I mentioned earlier, so that we do not want our facilities to be overwhelmed. They might be busy, but they were never overwhelmed, such that someone who is severe is not able to get the optimal standard of care because facilities are not available. So we managed to avoid that as well. I think all this as a package taken together is I think the reason why we've managed to keep our severe cases low.
Well, in the research that I found, Hong Kong and Singapore both really rely, about 70% of the population really get their primary health care provided by the private sector, right? But in Singapore, it seems to me the role of the GP, how can you address the role of the GP? It seems in many ways was effectively working with the government or controlling the spread. Here for a while there, we were hearing the private hospital want to be more used where they were not. They were criticized for a while there for not being as effective. But, talk about Singapore's lessons in this area in terms of the role of the GP.
Sure. Really it's not just the GP, but all of the private healthcare sector that really came together and stood side by side with the public sector. And it's really kudos to them and to all the healthcare workers that have really came together as one to fight this very, fight this threat. And this is something that was not built overnight again during the COVID-19 pandemic. In fact, the close collaboration between the public and private sectors have been built across the years. For the GPs, we have this program called the Public Health Preparedness Clinics. And these are sort of clinics that will be stood up during a pandemic. And this program has been in place for many years now, where we run exercises from time to time, where GPs are identified and they can sign on as public health preparedness clinics to receive training and to be sort of stood up during a pandemic. So when the pandemic came, the public health preparedness clinics, and there were, I think, almost 900 plus across the island. So these are the ones that primarily soak up the load of the patients who had respiratory symptoms or had COVID-like symptoms, while leaving other GPs to deal with other chronic conditions and all that, which still, would occur at the same frequency as before COVID. And so we tried to avoid mixing between the potential, COVID cases and the rest of the cases in the other GPs. This was something that, the GPs readily stood up as they had signed on to this program many years before. And that was very effective. The other private hospitals and other private sectors as well came on board to take up some of the patient load. So the non-COVID patient load from the public hospitals, because to free up the public hospitals to deal with COVID cases, the public hospitals, of course, has a higher capacity for isolation facilities and things like that. So they would deal with the COVID patients. And then the non-COVID patients, we managed to shunt a lot of these to the other private hospitals. Then a lot of the community facilities that I've mentioned, many of them were actually manned by private sector and also public sector healthcare workers working side by side. So you want to bring everyone, all the capacity that you have, to deal with the pandemic. You don't want to leave sort of capacities somewhere because you need that surge. And we managed to find it through the private sector and also other sectors. For example, the military, being one that obviously has a certain healthcare capability, came forward as well to help us in this time of crisis.
I see. And the question from one of the audiences says, how much of the action taken by the government were a result of prior contingency planning, or did it have to be reinvented as the situation progressed?
It's very much both, but much of the foundation was prior planning. Resilience is not something you build overnight, and certainly not something you build during a crisis. Resilience is something that you build across many years, and you inculcate that sense of togetherness. What we have in Singapore is a very strong whole of government approach to dealing with different issues, which we hone, through exercises, through small, I would say, events, and of course, through large crises like COVID-19, and also all of society approach, where we get buy-in from various stakeholders, academics, the private sector, the community leaders, and the community themselves. And much of this is exercise on a regular basis. it's put into our preparedness plans. But I think the best of preparedness plans would not have anticipated things that we have done in the COVID-19 pandemic. I can tell you that I think few people would have thought about things like border closures globally was possible, or lockdowns. I mean, these are not things that are usually associated with a pandemic. But what we have in our preparedness plans is a flexible model where we can react flexibly and nimbly to the situation as it unfolds. And that was very important when we needed to do things like lockdowns, where there was no real menu or no real playbook for us to just look at it and say, this is how you do a lockdown. A lot of things had to be invented, as I think what you've mentioned. But the foundation of collaboration is there. So it's easier than, I wouldn't say it's easy, but it's easier than, because all the stakeholders are on the table, and you can then work together to formulate some of these measures very much in response to the situation that's in front of you.
I think one of the question here, which is, you in your presentation, you mentioned the Singapore's realization, the importance of being a global city. And it's a city of 5 million people. It's small. In fact, I have friends who live there, and here in Hong Kong, we were very fortunate in that we have the parks. We have the population slightly more, but in terms of access to the greenery and all of that, I thought this 2 years of lockdown or 2 years of not traveling, we had something more. But I think Singapore realized early on that it need to open up and then get adapted to this living with COVID. And I guess this is an area where I think, again, zero COVID, there seems to be a competition with zero COVID or living with it. Do you think this policy, what made Singapore decided that they need to live with it?
Yep. I think every country, every society has to go through this entire phase of the pandemic and has to deal with it in a way that they deem, best fits their situation. And I think Singapore, initially, we very much went on a containment mode because there was, of course, great concern that the disease was severe. And initially, it was severe. It was certainly a lot more severe than many other diseases that we see in peacetime. And we didn't have an effective intervention like the vaccine or pharmaceuticals. So the most effective intervention that we can bring to bear at that point in time were all these public health measures. They were effective. The circuit breaker was effective in bringing down cases, of course, extremely painful. Many countries in the world also use border controls and public health interventions to bring down cases to whatever level that they desire. So we realized that while that was effective, it was also affecting, I think, society and the economy, and also not just the economy, but also the psychology of the people. We didn't want to result in a very long-term impact due to those measures, but we also didn't want to relax to a stage where severe cases would, and deaths would pile up and increase very suddenly and in a very large numbers. I think the population, would not, tolerate or stand for that. So we tried to achieve a balance. We open up somewhat to give people some liberties. We'll do some things, gather in larger groups and so on. But when we see cases going up, we then tighten those measures. So it's a bit of that dancing with the disease approach that I mentioned earlier. But subsequently, we realized that with an effective vaccine, with much of our population being immune either through vaccination or natural infection, and we realized that the Omicron variant was not as severe as the previous variants, and we realized that actually with vaccinations, most people would have actually quite mild disease, and the disease severity was not very different for the average individual. Then compared that, say, to influenza or other respiratory diseases, realized that actually that was a time that we had to really move towards a greater opening. So it was a very progressive process. It was not as if we woke up one day and said, oh, I think we should open up. Before we went into the lockdown, when we went into the limited lockdowns, we were already having an eye towards opening. And we had a lot of groups within government and also as part of a broader community to look at how we can safely reopen. It's taken us quite a while, of course, because of the twists and turns that COVID has plays upon us as a force of nature. I mean, no one expected a pandemic to last for 2 years. I think most pandemic plans globally that I've seen looks at pandemics of about 6 months in duration on average. 2+ years and still counting is a very long time. So, of course, it's been stretched out. But we had that end in mind. And so we went through the entire mitigation process to achieve this goal. And I must say that, as of today, we are in a pretty good place. But we will never rest on our laurels, as I mentioned.
Right. Well, I think one lesson I've learned from this last 2 years, anytime a country rests on its laurel or start bragging about how well they've done, something happens, whether it was Korea. And in fact, it was 2 years ago, the Asia Society president, Kevin Rudd, spoke to your dean about how well, and I think it was a talk on March 31st, 2020. And within weeks and months, Singapore's number went up, and same here in Hong Kong, same thing in China. So I think you're right about resting on our laurel. This COVID has been this kind of very wily virus, and so you have been in this field for a while. Has this virus surprised you? I mean, again, you said earlier we were thinking this was going to be, most times 6 months, but this 2 years, has it surprised you as well?
Indeed. And as you've mentioned, and that's why I think, part of the lessons learned very early on is that we need to be cautious. And we don't want to say that, we've achieved victory against this virus or whatever it is. It's a huge force of nature. A lot of things about this virus that we still do not understand today, even with all of the scientific achievements and advancements. So I must say that while the world has dealt with this pandemic, I would say, much better than perhaps it's dealt with other outbreaks and pandemics of the past, but we can still improve upon it. And that's something that we continually need to learn and improve as part of that cycle. And therefore, even now, as we open up, we are cautious. And you can see that, our politicians and the government has been telling the public that, yes, we've reached this stage of the pandemic where we are able to open up, but do not think that it is not impossible for us to go backwards, or in other words, impose some of these interventions again, if there is a very sinister and severe variant, or even a future disease X that I'm up here on the horizon. So these are things that we have to bear in mind, that all these liberties are hard-earned and it cannot be taken for granted. Some of the things that, were, I think, really surprising. One was that initially, there were so many unknowns that we had to grapple with. And that's to be expected in a pandemic. But also, there were very many knowns that were quickly identified. That was, to me, quite surprising in a good way. Because of our scientific advancement, because of collaboration between different countries, a lot of things were developed very quickly. The understanding that this was a coronavirus very early on, sequences that enabled us to make effective test kits and so on. Vaccine, which was developed and rolled out in less than a year, unprecedented in the history of vaccine development. Close collaboration and data sharing between, I think, pretty much all countries around the world. So that was the good surprises. The other surprises, like I mentioned, expected this maybe to be over in 6 months, but the pandemic kept throwing out new variants and new variants replaced old ones that were, more infectious and highly transmissible. So this ended up, dragging on and on. We did not expect that the world would go into pretty much a total shutdown of borders and air travel. I think at one point in time, air travel across the world went back into the volume not seen since the 1950s, which is, quite, big jump. And even now we're still reeling from those impact. And then, of course, the lockdowns, and which affects not just, like I said, society and economy, but also the psychology of the population. And this is something that was extremely surprising as well. Other things, of course, how we adapted actually as a population and a society to all these, I think, hugely impactful measures was also very surprising. Actually, I think the human spirit, we should give it more credit than maybe we have. I've seen a lot of things that have happened that really warms my heart. Things like healthcare workers coming together, and also the population coming together to support the healthcare community on this front. Like when we told the population that, although it might seem that the disease is mild and things might, or the numbers might be coming down, we have to hold some of these measures, public health interventions, for a little while longer because our healthcare workers are under stress and the hospitals are stretched. And the population really banded together on that. Other things like, working from home, using technologies like the Zoom platforms that we are now using now, and people carry on their lives as best as they can. Home deliveries, businesses transforming themselves, and so on and so forth. I think we have to give credit to a lot of these transformations, and many of these are actually even good to have even after the pandemic's over. I think we also want to learn from these. So I think a lot of surprises to me, some bad in terms of the way the pandemic has panned out, in terms of the length and intensity of it, but many good surprises as well that I think we should learn from them and incorporate them into our future, I suppose, new way of living with the virus.
Well, you mentioned, how soon the vaccine was developed within. I mean, that was unprecedented. And one of the reasons is the mRNA, right, research. And so can you, this question from the audience, ask, can you please talk about the finding from your recently published study on the effectiveness of mRNA versus the inactivated virus vaccine on COVID-19, your research in Singapore. Can you talk about that?
Yeah, I mean, I don't want to go into too much specifics about the research. I mean, the paper is readily available. I think there's been quite a bit of news reports about it, but it's not very different from research that other people have done across the world. And I think this whole pandemic has been about research collaborations. The development of the vaccine, like I mentioned, is due to research collaborations across many institutions across the world, also collaborations with regulatory authorities and also clinicians and public health professionals. We also use research to influence and to guide our policy making. So our policy making that we've done is all what we call evidence-based policy making. So we look at the evidence, we look at the data, we look at the research that we do and we commission. And with that data, we look at what are the best tools to roll out, whether it be public health interventions or vaccinations in this case. In fact, early on, we have also been sharing some data on the effectiveness of the mRNA vaccines, not just on prevention of infection, but more importantly, prevention of severe outcomes, which is the one that we're actually looking at. Because what we realize is that prevention of infection, the effectiveness wanes after a while, even with the booster, but prevention of severe outcomes actually is quite sustained. And that's what we want to focus on. And that's why we've been encouraging and recommending the population to get vaccinated with the mRNA vaccine. But we also recognize that there are other individuals that may not wish to get the mRNA vaccine, and there are other vaccines that are available as well. That also provides good, coverage. May not be as good relatively speaking, and that's what the research shows. That's the data. But we do encourage people to get vaccinated because a vaccinated individual is much more protected than an unvaccinated individual. I think that's the first distinction we need to make. And then we can look at the relative effectiveness of the different types of vaccines out there. And this is just for COVID-19. For future variant, this is for the current variant of COVID-19. For future variant of COVID-19 or even future disease, we don't know what technology or what vaccines might be the best. So I would say that in terms of investment and research, we continually have to look at new technologies, new platforms, or even existing ones, how to improve upon them. We can't just say that because mRNA vaccines are most effective now, that it will be always the most effective forever.
Right. Here is a question from the audience asking about privacy concerns. Can you address some of the privacy concerns of the Singaporeans regarding the community tracing app? And how did the Singapore government address it?
Indeed. So, there's always privacy concerns where you're trying to collect data. I think a lot of it stems from perhaps a misunderstanding of how the data is collected and used as well. So a lot of things that we have tried to address with the population is through a few things. Number one, communications. Secondly, firstly, the platform that is set up. It's set up to protect the individual. I'll go a little bit detail about that. Then communications to inform the public how this platform is set up. And then, of course, legislation to how do you put it, to ensure that the data is used in the manner that is set out to do. So in terms of the platform, which the Trace Together app uses Bluetooth signals, it collects the contacts of any individual, but the data resides on the phone or on the token for those who prefer to use the token instead of the phone. It resides on the app or on the token. It's not transmitted anywhere else unless the individual gives explicit permission. So if the individual, say, becomes a case, we will send to the individual a code where the individual can enter into their app, and that releases that information to the government. And the token as well. If an individual uses a token, that token has to be physically collected from the individual and paired with a device for that information to be released. If that individual is not a case or doesn't become a case, the information collected is only stored for, as I recall, 25 days, and then it is purged, so it disappears. So this is actually the safeguard that we've built in, and this is something that we have emphasized to the public as well. It's not as if your daily data that's collected is sent somewhere for analysis or whatever it is. It's not. The other safeguard is that all the data that's obviously, even those for cases that are downloaded, or for the sort of, for example, safe entry data, as I mentioned earlier, where individuals go into certain venues, that data is collected for determination of where people or cases have gone to, what are the risks, and then we can develop targeted policies based on evidence, like I've mentioned. All this is only available to people who need to know, and it's safeguarded very closely in our government databases, and this is also protected, by law. And I think our ministers have come on Parliament to say that this data will only be used for contact tracing purposes, and the only time that it may be released if there's any sort of I think severe or very serious criminal cases where it needs special permission for that data to be released. And I think most of the public understands that. I mean, in extreme, if you have, let's say, well, I'm not that familiar with that sort of the law, but let's say a murder case and, some of the data needs to be extracted. I think that's something that the public understands as well. We took pains to explain to the public on these fronts. So I think it's these three things: the design of the system, the legal protection, and the communication to the public. I think most people accepted this as a good reason to do so.
We're coming up to the end of the hour, and before we go, this one last question from the audience, and it's about vaccination of children. How do Singaporean parents how do Singapore convince parents to bring their kids to get vaccinated? Because I understand the schools have reopened in person for a while.
Yes. So there's always going to be concern about parents on their precious children, and rightly so. So a lot of it boils down again to communications and using evidence to support it. Although COVID-19 seems to be a generally mild disease across healthy individuals, for children there have been complications. Children with severe infections or COVID-19 related complications, and that's something that we have put out the evidence to look at the severity of COVID-19 and the frequency and the rates of complications versus the potential risk of getting a vaccine. And we've also shown through our local data and data from across the world now that, literally billions of people have gotten vaccinated, that is generally a safe vaccine. Now, nothing is without zero risk. So we communicate very clearly to parents through various means, whether it be public platforms, parent engagement, school engagements with the parents, and also healthcare worker engagements, and so on and so forth, different platforms, social media as well, to weigh the risk and benefits. And we say, look, the benefits outweigh the risk, and this is why we think it's really good for your child. And through that, we have actually got a very high uptake rate. It might seem that, of course, there are some vocal individuals who might be concerned. And it's great that these concerns are voiced out so that we can respond to them and have good debate on these issues. I think, we shouldn't, we should encourage this healthy debate and discussion. But I think for the vast majority of the population, after you explain and they listen to our explanations and also the questions that have been raised and our responses, the uptake has been great. And I think that's pretty much been how we've responded to a lot of concerns by the population, whether it be concerns about vaccinations across the board, concerns about some of the public health interventions, and so on and so forth. A lot of it has been to engage the public, to provide them with reasonable answers, and to use evidence to back up what we say. We don't just say something for the sake of it, but we back it up with solid evidence.
Well, what I've taken away from this is in terms of communication, I think you have talked about the effective communication. And also another takeaway for me has been really the ease of vaccination. Even preparing for today's program, I got on the website of the Singapore, the Ministry of Health website, and it seems very easy now to have walk-in vaccine for children at any age. So, and it seems to me a lot of the process, the ease have making it, also quarantining at home and so on. So I think there seems to be making things easier so for people can follow the rules as another takeaway I've gotten from here. Is there something that you, over 2 years into this, what are, you as a scientist and you as looking at this, what are some of your concerns now? With the summer months coming up, maybe the cases will kind of wane. But do you foresee another, whatever versions of Omicron coming up and, the effectiveness of the vaccine, like you said? So what is your personal concern about this virus?
That's right. I mean, the virus is continually mutating. That's part of its natural evolutionary process. And we are fighting against a force of nature. So never underestimate it. I think it's something that we have learned the hard way over the past 2 years. And that's something that we're also keeping an eye out. Of course, my concern is that, a new severe variant will emerge that will result in, a lot of the things that, a lot of the successes that we have made being sort of pushed back. But in a way, we are looking at ways to prepare for this so that we do not repeat a lot of the, I suppose, I wouldn't call them mistakes, but gaps maybe in the past, and that we can strengthen our preparedness response systems for the future. So my concern obviously is, a new variant that maybe it's like you mentioned, the vaccine is less effective against, that maybe even not COVID, a new disease X that might happen in the future. Like I mentioned, it's not if, but when it will occur. And that's something I think we always need to keep at the back of our minds. But at the same time, there's a lot of advancement as well. People looking at newer vaccines, including pan-coronavirus vaccines that may be effective against, maybe all different COVID strains. And also better surveillance systems that we've had, better sequencing. We're finding out all these different strains, and it appears in the news all the time. But it's good that we know of these things so that we can assess and better prepare for them. So I think while we are concerned about it, I think we are also looking out as to how we can deal with this situation better in the future. So is that whole building back better programs. And also, I think the lessons learned in that we need a whole of government and whole of society approach. I think if we can maintain that, not just in Singapore, but I think in many countries around the world, I think we'll be in a much better place to deal with whatever COVID-19 throws at us. And this is something we can't predict. So I don't have a crystal ball. I can say that hopefully whatever occurs, we will be able to respond in a much better way.
Thank you. Thank you. On that note, I want to thank you so much for joining us this afternoon, and so envious in some ways of Singapore's opening today. And I know, hard-won battle after 2 years of being in code orange and now code yellow. And I know hopefully Hong Kong will be joining that very soon. And I know you're going to be traveling. In fact, that's one of the reasons we were having the program this week. And I think we certainly have learned a lot from you, from about the lessons from Singapore. And I think this is going to be something we're going to continue learning from each other. We don't know what's going to be around the next corner, but long as we continue learning, and like you said, follow the evidence, rather than the fake news. I think that the evidence will not lead us wrong. But thank you so much, and I want to thank the Singaporean Consul General Ong in Hong Kong for introducing you to us. And I look forward, perhaps in the future, welcoming you back, and to hear more lessons from Singapore, and then also Hong Kong. We've learned so much this last 2.5 years, 26 months or more, and I know we're going to continue to learn from each other. And I want to thank all of our audience for joining us today. And our next episode, episode 39, will be on infodemic. We're going to have an expert from WHO. Besides the pandemic, and I think some of the new things we learned about this year from with the pandemic has been the infodemic. But with it, there's been good, and then there's bad. And I think that's going to be something we're going to be tackle on our next episode. So stay tuned. So again, thank you, Professor Lee, for joining us.
Thank you so much for inviting me to the program, and hopefully we'll be able to meet up in person, and also with all of the audience and everyone. Thank you.
Thank you. I know the travel bubble between Hong Kong and Singapore never happened, but doesn't mean we are not going to be opening up soon. It'll be great to be able to visit Singapore and have you visit here in Hong Kong. So thank you so much.
Thank you. Thank you so much. Have a good day. Cheers.
Good afternoon. Bye-bye.